Hello, everyone, and thank you for joining us today. It's fantastic to have so many of you with us. We've got a fantastic session for you today and lots of content to get through. But again, this is always a really important opportunity to network and connect with others within your profession, but also counterparts in other fields. So for those of you that are here on time, please can you do me a favour and say hello in the chat, introduce yourself, who you are, what you do and where you work, because it's always great to see who's here and to connect with each other. Throughout the session, there'll be an opportunity to ask questions. So if you can put them in the Q&A, that's great because others can upvote them. Those that get asked upvoted the most will be answered first. If you have any other comments to share or thoughts or ideas, stick them in the chat. We'll keep an eye on that as well. I'm Jo Stanford. I head up the Healthcare Project and Change Association, and I'm delighted to be here alongside others today. But let me just tell you a very little bit about us. We are a not-for-profit community interest company representing the project and change workforce in the healthcare sector. We're UK-wide. We have regional networks in each of the regions, including Scotland, Wales and Northern Ireland. And we are here to support the development of the project and change profession, but also to provide capability to the whole workforce. Let's be honest, everybody gets involved in projects and change, and it's really important that everybody has the knowledge and skill to be able to do that effectively. We have a group of great webinars coming up, and anybody who's interested in change management or understanding more about it, particularly with the things going on at the moment, we have a fantastic session with the Cotter Institute. So anybody who knows about John Cotter's work in terms of seminal expert in change management, he's one of his teams doing a session for us called Leading Through Uncertainty. We also have some other sessions coming up around storytelling, sharing your value stories with Bryn Hodgkiss. We have one with transparent choice around driving efficiency without compromising care. We know that this is on everybody's agenda at the moment. And we have another event with FEDIP, change management for digital transformation, excuse me, from hospital to community. And we also have one in terms of developing new services, joint services. And we have Jules who will coming to talk about the development of non-surgical oncology service between trusts. So for anybody who's doing OICS level change or organisational mergers, that's going to be an interesting one to see how to work with people effectively. We also have some regional network meetings coming up, and our first Wales one is on the 24th. So if you're in Wales and you'd like to join us, it'd be great for you to come along to that. These are all on the website and links will be dropped in the chat for you to find. We provide training and development. There's some great free online learning for those that want to know the basics of project management, change management, and if anybody is an SRO, we have training around that as well. And if anybody is interested in the next level of training, we have some essentials courses that people can look at. We have some core courses in change management, neuroscience for change, workshop style, and also becoming a change ninja, as well as that next level SRO training. Our organisation is managed through organisational membership, and this is about getting the organisation to invest in the maturity of its capability and in terms of maturity of the governance and delivery of its programmes and projects. So if your organisation doesn't have membership, just test them out and see if they're interested. Can support you, can support your organisation to get better at delivering projects, but also support the workforce with professional development as well. I'm here today alongside Sarah Scrivens from the Federation for Informatics Professional, and she is going to tell you a little bit about that. And she's then going to introduce our expert for today, who's going to tell the story. But we have a question for you in Menti. So if you can take a snapshot of that QR code now, or make a note of it so that you're ready to put the answers in when John, who's delivering the session, gets to that point. So I'm just going to leave that up for a moment, and Helen should be dropping the link into the chat. So if you want to use the link and do it on the website, or you can use your phone and scan the QR code. And if everybody's got that, I will hand over to Sarah and say, welcome, Sarah, and thank you for joining us today.
Thanks, Jo.
Thanks, Jo.
Bit of an echo. Okay. Is that better for an echo? There we go. I'll start again. Good afternoon, everyone. So lots of new faces today and lots of familiar people as well. It's lovely to see you all. For those of you, as we've got a lot of new faces today who are a little bit less familiar with FEDIP, FEDIP is the Federation for Informatics Professionals. We're made up of 6 professional bodies, AFA, BCS, CHCIO, CHIME, IRIM and SOCTIM. Broadly, they cover all the areas of practice within health and care informatics, so from analysts and clinical coders to clinical informaticians and machine learning specialists. There's some information in the chat. You can learn a bit more about each of those individually, but together we make up FEDIP. We're the only UK public register for digital health and care professionals. So our mission is to support professionalisation of this workforce through registration, through the national standards, and growing that cross the sector community, as well as sort of Jo alluded to. And I just wanted to touch on professionalism today ahead of John speaking. So I know John's touching on this in his presentation as well, but it's something that underpins everything we do really. Because I can see there's many clinical and finance colleagues as well on the call today. So welcome. 2 very well established professions where formal registration and professional recognition are not just expected but essential. And that professional recognition helps, support access to structured CPD, recognition of the role, a respected voice at the decision-making table, a place at the decision-making table even. So FEDIP is really there to help, historically our somewhat newer profession have that route to professional registration. Professional registration can provide that recognition, post nominals after your name, a clear way to show that you're part of a profession, you're committed to high standards, and just bring that sort of parity with other professions across health and care. So FEDIP does that through our public register for those who have evidenced against the standards. And then once you're registered, support through your professional body, and support through the FEDIP hub with accredited and endorsed CPD materials to help support you through your continuous learning. We also help amplify the voice of the profession through various advocacy initiatives, which is partly why we're here today, this series of joint webinars on organisational preparedness with HPCA. And after the webinar, we'll be sending out just a short survey that we'd like to invite you to support. And I feel the collective sigh come through the screen when I say the word survey, and I totally get that. However, it's a joint initiative between FEDIP, so all of our 6 professional bodies, and in partnership with HPCA. So your responses will inform a white paper, and we hope with the support of so many organisations involved working together in this and your responses, it's an opportunity for the profession and your voices to be really amplified, to show a true picture of where we are as a profession when it comes to readiness for AI, data, digital transformation. So very grateful for any support for that initiative through the survey. But so I don't want to ramble on for too long because we're all here for John. So let's turn to what professionalism looks like in practice. There you go, I've hyped you up, John. And I'm very pleased to welcome John, who is a FEDIP leading practitioner, a member of AFA, one of our professional bodies, and Director of Strategic and Service Innovation at NHS South, Central and West. So without further ado, very happy to hand over to John. Thanks, John.
Thank you, Sarah, for kind introduction. Just can I check if everybody see that okay? Is that come through? Brilliant. Yeah, so thank you. Thanks, Jo and Sarah, for the kind invitation today to speak to the Healthcare Project Change Association. So my name is John O'Connell. I work for NHS South, Central and West, and we provide support and transformation services for health care systems to achieve the best possible outcomes for their people, their communities and their populations. I'm also a non-executive director for AFA, the Association of Healthcare Professional Analysts, and that organisation support. The aim of that organisation is to raise the profile, similar to what Sarah was talking about, for healthcare professionals to ensure that they're professional, they get the professional support they need, and similar to HPCA, have that network and community to sort of engage with each other and learn together. I'm passionate advocate for transforming healthcare through innovative use of digital and data technologies, data, and also working closely with strategic partners such as industry, because I believe we can both learn together. And I hope that you find this presentation both insightful and helpful. I will canter through at a speed, so apologies in advance for that, but I will share the slides afterwards, and there'll be some barcodes and links coming up throughout the presentation for other stuff to link to. But I hope hopefully it'll help you on your career progressions as you, like me, work forward for positive change and transformation that's needed in the NHS. So just to say and to kick off, so what are we going to talk about? What's the flow of the presentation? So first and foremost, I thought what I'd talk about is some of the wicked challenges the NHS faces, but equally, what are some of the digital and AI opportunities that we've got within our gift to reach? I'm also going to talk a bit about how you prepare as an organisation for these, what are the things you need to do, both from workforce skills, but from a personal perspective. What's some of the data governance aspects you need to be thinking about? What does this mean also for data and system interoperability? And then some of the takeaways. And what I've tried to do there on the bottom right-hand corner in those 4 boxes is just try and give some takeaways, because I'm aware that we've got quite a diverse audience on the call. So what does an organisation need to consider from a leadership perspective? What are some of the things, and from personal development? So as we go through in the slides, you'll see those boxes appear, and hopefully there's some takeaways in that area of interest. So just to kick off, so my role in NHS SCW is kind of threefold. The first one is kind of gathering some of the ideas, the sort of new innovative opportunities and ideas that across industry are using, but in our organisation that we can innovate and imbue within our organisation. So come up with a pipeline of kind of new transformational technologies that can change what we do today. The second part is probably one of the most difficult part, is the reframing, working really closely with business leaders and challenge their assumptions on the way they do business today. Could they be more efficient on their service? Could they make it more productive, and could they deliver more value at less cost? So that's the sort of some of the conversations we have. And then innovation is no good unless the rubber hits the road as such, and it needs to be embedded within BAU. So it's having that conversation to bridge the gap between the innovation idea and the BAU services. So within those kind of 3 areas is kind of where I work, and our focus is on 3 fronts. And I'm pleased to say these still hang very, very clear today. They still hold true. Cognitive automation, you'll have heard of RPA, robotic process automation. You'll also heard of Copilot, running those out throughout our organisation and adapting those. Cognitive insights is where we have a lot of information and data in the NHS. How do we link all that data together and use AI tools such as machine learning, neural networks, generative AI? How do we leverage those tools to get the best insights that we need to do? And the final bit is cognitive engagement, where we use and bring forward digital technologies to improve the patient journey. So you'll see things like, for example, the NHS app, the NHS front door, all these apps that are coming through. So in those 3 areas is where my keen focus. But before I kind of move on, I want to just set the scene a little bit of some of the challenges we face, and just to sort of look back a little bit to the 1800s, something called the Great, I know it's not a great title, it's called the Great Horse Manure Crisis of 1894, where in the late 1800s, large cities around the world were drowning literally in horse manure. And just to sort of flick through, is that working? The next slide. Yep. So in the 1800s, large cities were literally drowning in horse manure due to dependency on thousands of horses and transport of both people and goods across London. There was a staggering, I believe, 50,000 horses transporting people and goods around the city each day. And the manure of London streets attracted a huge number of kind of flies and spread disease. You had things like typhoid fever, diseases. So massive, massive health problems were beginning to sort of come through. However, all of this challenge that they had, they were thinking how they get rid of this. By 1912, this seemingly unsurmountable problem had resolved around the cities around the globe, and had been replaced because of the introduction of motorised vehicles that had become the main source of kind of transport and carriage. So with necessity as a mother of invention, the petrol engine literally saved the day there. So that was kind of what it looked like. So you can imagine it must have been really a tough place to work. I think we have an equally similar challenge, and the challenge is this. For the NHS, we have on one side three key, what I call wicked challenges. The first one is multi-morbidity. Treatment of a single disease is common, but multi-morbidity is increasing. That's people with cardiovascular disease, maybe a cancer, maybe diabetes. And in England, people with 4 or plus conditions is expected to double by 2035, which is huge. Also, a second challenge there, if you look at health and well-being, only 10% of our health is linked to access to healthcare. 50% is linked to healthy behaviours, but sadly the NHS only invests 7% of the national expenditure on healthy behaviours. So we need to sort of do things radically. And then challenge 3 there, a big challenge. We have an ageing workforce. 18% of GPs set to retire over 55, and 46% of community nurses who do all that great work in the community, which will continue to grow. 46% of those nurses set to retire in the next 6 years. So that's a massive challenge. But on the flip side of that, we have great opportunities. We have the opportunity to leverage digital technologies such as genomics, such as digital medicine, AI, and robotics to tackle these kind of 3 challenges. But we need to do it safely and securely and robustly. So that hopefully sets up the scene for what's the organisational preparedness needs to be. So what I wanted to do is just to introduce something called the MELDS framework. So Doherty and Wilson created the MELDS framework. They did a bit of research because they knew that introducing AI requires a kind of radically different response, both from management and leadership. It's not a binary sort of narrative of kind of what a human does and what a machine does. Fighting for each other's jobs is basically what they said is what they wanted: future symbiotics working together. So they came up with these 5 crucial principles. First one is mindset. Have a mindset for experimentation and be open. And there's something called the missing middle for roles. The second piece is kind of experimentation, taking the opportunity to test and fail and learn. The third piece is leadership. Again, rather than command and control here, they talk about moving towards autonomy, giving people access to do things and to test and experiment. Data, there's more data going to be coming through. We're going to be using a lot of unstructured data, which hasn't been tagged, so it's a big challenge in itself. And then also the new skills. These new technologies bring with it a massive increase in skills development. So this is the missing middle that they came up with this model. And one side, that when people do new roles, they look at the human aspect of what the humans are good at, and then they say, oh, that's a human job. And then they look at the machine, the AI, and say, well, that's an AI job. But the most important thing is to look at these together. What things do humans have that complement machines, and equally what things do machines and AI do that complement humans. And that's what they call the missing middle. And they say when you're creating and crafting new roles for the workforce, think about this approach. So from an organizational development, and just to give an example, what we've done here in SCW, our organization, we had this challenge that we try to address, and we are trying to address, is to define what's the optimal how do you define optimal and reduce health inequalities in care. And to give an example, so patient A has diabetes and coronary vascular disease, goes in and out of hospital a lot of times, costs quite a bit, £20,000 per annum, but has relatively what you class as poor outcomes. On the opposite side, you have patient B, diabetic, has coronary heart disease as well, very little impact and engagement with the health service as such, only costs £7,000 a year, and has what you class as relatively good outcomes. They all interact with these services of 111 A&E and inpatient as their primary model, and they're the sort of services they touch. So what we wanted to do was to sort of look at from a high level and think, well, could we look at these kind of things that people typically look at, like multi-morbidity? Yes, it drives costs, but it doesn't just occur in elderly. Young people can have multiple conditions, so that's something to think about. It's also, when it comes to cost, emergency admissions were always championed that the only game in town, but they're not necessarily the only game in town when it comes to cost. And also the high cost on the last one there, you see, the high cost of kind of high risk groups doesn't directly translate into frailty, and nor does it translate into a readmission. So these were some of the things that we were looking at as well. And it kind of links in with kind of, is the money spent in the right places? And I'd encourage people to have a look at Samuel Gray, and the Oxford Value Stewardship Programme has done a great bit of work looking at waste, whereas the intervention, waste is when intervention doesn't achieve the outcomes that matter to patients. So we could be spending money in areas that aren't achieving good things. So what can we do differently using that MELD framework? Well, how do we define optimal care to reduce inequalities? There's a couple of things we could do. We could look at best practice, NICE guidelines and evidence-based medicine to see, what does good look like. But we've got AI, haven't we? We could get the machine to tell us. So ideally, if the machine tells us what good looks like, and that's what we've kind of done, we've linked data together in SCW, and we've created a product called Integrated Pathway Tool that shows kind of the optimal journey a patient should take through a healthcare system based on their conditions and their case mix and the services that are available to them. And the way we did that was by linking creatively data from 111, A&E, outpatient, primary care, and mental health data, and all of that with proper robust IG governance to sort of help us on that journey. So just to give you an example, that's a different way of thinking and doing things using kind of the principles of that kind of MELDS network. And I just wanted to finish off as well, and the last bit on the MELDS network was the skills. These are some of the skills that are going to be coming through from using advanced AI and these new technologies, and the things that they call these are things they call the 8 fusion skills that are necessary for reimagining jobs in the future. I'll just pick a couple of them. So the first one, rehumanizing time, giving people time back to do the interpersonal skills, to focus on creativity and decision making. The fourth one there, looking at intelligent interrogation, a really important thing, knowing how to ask the best questions of AI. Really important skill, but we don't spend enough time on that. The 8th one there is looking at relentless reimagining, creating new processes rather than automating the old ones. It's really important to have a look at that. So they were kind of, and there were some of the things to have a look at on the skills piece. And then I wanted to do a shout out for people on the call here today. There's some really good resources from a skills perspective. AnalystX has just launched the NHS Digital Academy. If you click on the QR code, you'll be able to go straight through that. I think the link is going to be put into the chat, but they are really doing some amazing, great work. They're focusing on new talent, upskilling existing workforce with apprenticeships and certification, supporting that professionalization journey, data leadership for the skills, and focusing on data literacy and confidence to ensure that staff have the confidence to be able to work with data. But really, really great repository of information. And just a shout out from a leadership perspective, what does it mean for a chief data analytic officers? There's more of those needed now through the NHS. One of the things I would champion would be start off with a maturity assessment of where you are currently today. Gartner offer a framework, as do other organizations, as many other ones, but this one looks at kind of your data strategy, your kind of the functions that you provide to support AI, and it kind of looks at kind of where is important to you. So, for example, on this one here, it's say what's important to us on the blue bars that are going through, and where's that sense of maturity on that curve going through. So, is there a big gap or is there a small gap? Are we kind of, and the benefit of that is then you can rank that analysis and to say where the key focus areas needs to be. But a really good starting point is to do a bit of a holding of a mirror up to yourself and find out what you need to do differently. And then moving on to workforce skills, what's going to be the most important thing, I think, from an organisation perspective, but from a leadership perspective too, with these new technologies, is what I class as the talent and technology challenge. And this is the single greatest factor that will drive organizational success in the future, is the ability for organizations to pair the technology advances with the talent strategies. A really hard thing to do, but they call this workforce digital dexterity. So every program that we have within our organization in SCW, where we're transforming, is looking at, can we digitize, can we automate, can we bring new data and AI to bear on the services of the future. The most important takeaway really is to ensure that your executive has a minimum of 20 hours learning before they can radically and productively engage in defining a digital roadmap with colleagues. This is one of the gaps that organizations have, in the sense that, you have subject expertise all around your organization, but your executive does need to put the hours in. And this is some research that McKinsey did to ensure success. These are the investments that were kind of needed. So from a leadership perspective, what also does it mean? This was a sort of a takeaway I took from, it was an MIT Sloan CHCIO symposium recently. I think it was last week, and what they asked, they interviewed the candidates, what's the most important for leaders in the AI age, and they came up with these kind of assessments. So I think just to pick a couple out there, courage to reimagine what's possible. Just because you do things today, it doesn't mean you can't change and think completely differently. Explore the future, but stay grounded in the present. That's a really key one, because you may have great ideas, but do you have the funding and the resource to do that? Think of that MELDS framework. And I'd encourage, most importantly, as Sarah and others have said on there, is that continuous learning in professional development. That's really key. But be patient about, be open about kind of AI's possibilities. And then the last one there, be patient, but take AI seriously. And just to sort of finish off on there, if you rush people, if you rush a miracle man, you get rotten miracles. And that was a quote taken from the Princess Bride. But be really careful what you wish for. And it's a good lesson to have. From a sort of a management perspective, if you're leading in this space, and there's a really good book there by Tenki Feng, and he talks about the human aspect of data strategy, really important. And he came up with these 5C framework: competency, competence, empowering everybody in the organization, not just a little few people or a small cohort. Collaboration, we're doing this within our organization with SCW. We've got 4 organizations coming together, really collaboratively working, finding out who's the best at what and what can we share for each other. Really powerful. And again, communication, audiences want to be told things differently in different narratives. There's lots of acronyms, and I apologize if I'm saying any of those acronyms, but you need to make your audience understand exactly what the sort of power is of this new technology. And then conscience as well, secure, compliant, and ethical, really important. And then creativity, the motivation, and create the environments. And I would say that one of the most important things as well is that when you send your staff and your teams off for training, do ensure they have a sandbox when they come back to base to be able to test their new technology or new ideas with, because that's where I see a huge gap. They get the training, they get frustrated, they can't use, and you lose them. So a really important takeaway on that. Also, from another aspect from personal development, this is, while it's only I put here, while it's only a thought experiment today, I do think we need to be wise and prepare for what we class the blended workforce in the future. The next generation of managers will be a management of teams and also AI agents as well, so be a blended workforce. So how do you go about doing that? Think of that growth mindset using the MELS framework. Most importantly, we had a great meeting in our organization yesterday about responsible AI and how you bring that forward. And I'll be talking a bit more about that, but also that unleashing, creativity between what the human can do and what the AI can do. But a big focus for me, I think, really is on continuous workforce ultra learning. And ultra learning, there's a chap called Scott H. Young, who basically says ultra learning basically is a strategy for aggressive and self-directed learning. So what he means by that is self-directed means rather than waiting for people to pay or your organization to pay for expensive tuition and tutors, you can take control yourself and just look for what's out there. And the aggressive bit means rather than spending years on something that without getting great quickly, you then put your time and effort directed towards what works. So there's loads of micro education out there. So a big focus on that ultra learning is really key. And then finally, just to sort of flag up as well from a personal perspective, which I found very helpful, was Ethan Mollick has written a really great book called Co-Intelligence, where he describes AI as an alien that we need to get used to living with. He also describes it as a sort of eager intern that will try to do everything right for you, but forgets when it does things wrong. So he's got 4 principles, which I think are really powerful from a sort of working perspective. Is always invite AI to tables. Think, can you do it? Not what's the business challenge? Can AI help me in there? Be the human in the loop, check everything that's been done, and treat AI that you put in your systems as a person and tell it what kind of person it is, because it doesn't know that. So it's important to do that, and assume the worst AI you've ever worked with. But and the 5th one that I put in myself is focus on professionalization as well for yourself while you're going through this journey. And to do that, again, just a shout out to AFA, the FEDIP on the call today, and also the Health Project Change Association. So there's some great organisations in BCS, which I'm a member of myself, where you can get professionally registered. But I also wanted just to flag on here from an ultra learning perspective, Future Learn, the Alan Turing Institute, the NHS Data Academy. There's some great free resources that are available on there, like the Alan Turing Institute has some amazing content around AI, looking at fairness, looking at safety, explainability and accountability. So encourage people to have a look at it. And then the Hartree Centre for Training Portal has some great training resources there, part of the UK RI initiative, looking at data science, artificial intelligence modeling and emerging technologies. So all of this is freely available, and I'd encourage people to have a look at it. And just to flag pull a few out there. These are sort of 3 I think are really worth having a look at. So a shout out to Samuel Gray, a friend of mine, who is his team at the Oxford value-based team up in Oxford, they've pulled together an introduction on value-based healthcare. So before you do any AI, is look at what problem you're trying to address first. So he's got some really great modules there that talk about kind of health, population health management and the challenges we've got. On the second one there, the Alan Turing Institute, as I mentioned, has got, he talks about AI ethics, governance in practice, talking about sustainability, AI fairness, responsible data stewardship, which is really, really key, and explainability and accountability. And then the last one there, again, is just that digital area I mentioned about the facility councils, the UKRI, lots of courses there to encourage. So those links, I think, hopefully going to be shared in the chat with everybody there. And if you are thinking about training and upskilling yourself, as I mentioned, that ultra learning approach, do consider that sort of 70-20-10 approach, where 70% is on the experiential learning, on the job development, and look at what job rotations you can do. It's really, really powerful. We do that with a lot of our teams within SCW. And then the other one, the 20%, looking at the relationship, talk to system leaders. What are they doing? Share their knowledge, online forums such as we're doing today, and then the 10% on the formal training. But it's a really good model, I find, for doing that. So going to move on to data governance. And just to sort of flag up there, other people can read that as well. So yeah, interesting. This is through 2026, those organizations that don't enable and support their AI use cases through an AI-ready data practice will see over 60% of AI projects fail on business case and be abandoned. So there's a big challenge there that we need to try and address, making sure that our data is AI ready. And on that note, I think we're going to go to the survey. I'm going to hand over to, is it you guys? Yeah.
Okay, great. Thank you, John. Brilliant insights, and everybody's really fascinated by all of the references and the training, etc. You called me just as I was taking a bite of sandwich.
No worries.
But we have got some great results, and people have really completed the questionnaire so far. I did make a note of some of the others. So obviously the vast majority is saying that a lack of understanding is one of the biggest issues with the AI data challenge, followed along by getting a handle on their data and also bad data, which I suspect correlates with your understanding of things as well.
Yeah.
Just in terms of some of the comments that people have put in the chat about the others, other issues, information governance, approvals and use of the data.
Yeah.
That was commented on. Capacity for validation and delivery, a lack of clinical risk management.
Yeah.
Shadow AI, and AI doesn't differentiate between truth and untruth. Will AI water down truth? And how will we know? We've also got ethical and legal concerns. Who owns the data?
Yeah.
Real-time data constraints. A bias in representation issues, which I think we're familiar with as well. But also there's a comment around digital maturity, where organisations don't currently have up-to-date PAS or EPR systems in place. Is this going to create greater disparity between the haves and the have-nots? If you've got other comments or other suggestions, put them in the chat and we can read those as we go. But that's the gist of some of the other other issues that are faced at the moment.
Brilliant. Yeah, no, really, really good sort of feedback on there. I think, digital maturity, absolutely, like data analytical maturity, it goes hand in hand, and that kind of assessment. So, encourage organizations to have that mirror holding up to themselves and saying, where are they on their digital maturity journey? And I think what I'd take from we had a really good meeting yesterday with our colleagues in different CSU about kind of, responsible AI, was that we're all learning this together. So be open about it, start looking at some of the great stuff that the Alan Turing Institute does, and use those guys. I'll share them up. But no, they echo actually on the slide I'm going to show now, actually. So really, really good to have that. Yeah. Just share my screen back again. Hope that's come up. Does that come up for everybody?
Yeah, great. Thanks.
Great. So yeah, there's the key data challenges. Again, was lack of understanding was one of the first one that was the top, actually, that came through from the chap called Rob Thomas, who's written a really good book called The AI Ladder, which is got some really good blueprints on there. But lack of understanding, many organizations jump to implement AI solutions because of its increasing popularity, and they assume it will fix a business problem. But at its core, you really need to sort of make sense of kind of what's the challenge you're doing. And AI will use vast amounts of unstructured data, and you need to ask yourself, have you got control or sort of sight over that unstructured data? Get a handle on data. Again, data is the foundation of data, but good data is needed for training. So have you got good data again? To infuse those models that you're using. Lack of data, again, making data available but safely available throughout your organization. That's one big challenge. And too much data, then that becomes what they class as kind of an engineering problem from the data engineers. So how do you kind of address that? And then bad data, top priority. 60% of organizations were challenged by managing bad data that was sort of put in. So yeah, it kind of echoes exactly what was on those slides and what you flagged up as well. But interesting as well, just a quote on that just be really careful that no amount of kind of algorithmic sophistication will overcome bad data and architecture. You do need a good architecture as well. So bad data is simply paralyzing. So what they're saying here is that, if you don't have the proper infrastructure as well to support it, you may have good data. That's a challenge that we're both working within our organization, is getting that data right and also putting that infrastructure that supports kind of the AI programs going forward. So what are the kind of pitfalls for using AI? And these were some of the ones that came up from Oxford. We're saying these were 3 of the kind of pitfalls for AI to watch out for, which is privacy, data exploitation, predicting, and people using it for profiling. In the US, I have seen some horrific cases where people have been profiled and arrested, kind of like a thought crime, in the sense that if you're in the wrong place at the wrong time, the wrong demographic, they pick you up. But just take note of that. Replication, again, talks to very much the black box, where data is pushed in, something's done around the weightings of the neural networks, and the decision or an output comes out saying yes or no. So if you can't explain why that's doing that, you're on very dodgy ground, I would say. And I think you've got to be really careful of that problem. That was the second one that came through. And then I think, Joe, as you mentioned, bias within healthcare data. Lots of underrepresented groups come to healthcare late. So it doesn't mean that they don't need healthcare. It doesn't mean that they don't need healthcare. So, we need to be careful with the data we have within the NHS. It's got very inbuilt biases already in it, and we don't want to make that worse than what it currently is as well. And so just be vigilant for all these pitfalls. And I just put it there. The Alan Turing Institute has got a great publication on understanding artificial intelligence and ethics. They've come up with 3 things, which is some values, looking at kind of respect, connect, care, and protect. That's the first piece. The second bit is they've got something called the fast track principles that they talk about, and that's looking at fairness, accountability, sustainability, and transparency. And then they bring all that together into something, it's a weird name, it's called a PBG framework, and that's process-based governance framework, which we're actually working through ourselves. And that looks at a governance framework that brings all of that together in a sort of safe way. But have a look at that. So, why is all of this important again? Why? Because humans, fill in the gaps and the missing details with experience. And AI builds up from details. And if you look at it, Chihuahuas do have kind of muffin-like looking faces, and Dachshunds, when they curl up, they look like bagels. So there are problems that can happen. So we fill in the detail with experience, but AI can make mistakes as such. And just to talk about the generative side of that, which is very, very topical, 30% of generative AI projects will be abandoned after proof of concept due to poor quality data, inadequate risk controls, escalating cost, and unclear business value. So what do you need to do from a risk control perspective for AI? And what MIT have come up with is some what they class as kind of AI guardrails. And the guardrails kind of help you ensure the organization is safely using it as it should do, in line with national policy and in line with the values that it sort of aligns itself to. And guardrails, the main types of guardrails are looking at the appropriateness of the actual AI that you're using, checking its hallucinations. Are they enough to sort of affect the output, but also ensuring that you've got regulatory requirements with NHS, alignment and validation. Those have come up. So on the alignment, keep the outputs consistent with user intent and brand guidelines, but the validation, check content against specific criteria. Just be really careful on that as well. And then the last one on there is just look at some of the benefits which I've put up on there, which are things around ensuring enhanced security, ensuring compliance and trust. And I would also add on a last one on there is your reputation as an organisation. If you're starting to work in this space, making sure that you've got those guardrails in place. But yeah, really good read there is from McKinsey that talks about how you kind of go about and do that. And then moving into finally sort of system interoperability. There's a big challenge here because we've got technology and we've got old systems and old ways of working. We can't just rip and replace everything. So what does it kind of look like? So this was an architecture that was drawn together from Rob Thomas in his AI ladder that I mentioned earlier. It just provides organizations with a very simple high level understanding of what they need to do to set the architecture up to support AI, like collecting your data, making it simple and clean and accessible, organizing your analytics into a foundation in the middle for analytics, and then scale the AI with trust and transparency, and then moving up into operationalizing it in business. So that's kind of what it kind of looks like from a very high level. And within SCW, we've developed something which we are working towards, which is similar to this. This is what it is. It's kind of based on some work that McKinsey have done. And the benefit of this is kind of creating a new infrastructure, a new platform. And there's 4 key things that are different to the new way of working against the old one. They call them the 4 foundational shifts to upgrade your architecture for digital and also for AI. And the first one is moving from point-to-point systems. So rather than having a unified system, it's all decoupled. So you have reusable assets. So all of these areas in here can be either switched on or switched off. The second piece is moving from sort of manual automation to code. So you write code and everything's done automatically. And the third thing is move from fixed to evolving. Again, it means that what you see here today on this diagram tomorrow may be very different for another service. So having that flexibility. And then the fourth piece is moving from batch to real-time processing. So at the very bottom, you have your systems of record, which are your existing systems within your organization. That information is pulled through to unified data analytics core. And again, in there, you'd have kind of what are classes, your sandboxes would be in here for people to experiment safely. And then you have your kind of your orchestration layers. These are layers that take data up and actually do something. They pull information up and they serve the information to that persona, be it that nurse, be it that doctor, be it that patient. And then other engagements you have as systems engagements are things like a digital contact center that will reach out either through mobile, either through web, or either through text, but also by phone as well. So it's important that you cover all aspects so you don't create, exclude from a digital perspective. And that's kind of, so just to give an example of what this looks like for us within our organization, we did something with our organization Care Navigator service, and that service delivers patient transport to patients who need blood transfusions, who need, for example, trips to hospital. Have a huge amount of calls coming in, so there was a lot of pressure on the call wait times. We sometimes sadly up to 2 hours, but they also had lots of complaints coming through because the waits and the transport wasn't working. We had lots of staff turnover because of that. With this digital technology that I just mentioned, we've now got some early lessons and insights from the pilot, and we're now going live. So things, for example, like the call volumes were much higher. Now we have the data. We didn't realize that the volume of information that was coming through the service was a lot bigger than we'd ever anticipated. 30% of calls were handled by the interactive voice response, which was able to give people the answer straight away. That didn't need to come necessarily through, which is great. And callbacks, that was really interesting. Most of the staff that we worked with said to us that when people phoned in, they wanted to be answered straight away, but that wasn't the situation. When they got an option to phone back at a time that was suitable for them, 30%, over 66%, sorry, I think it was, took that option to be phoned back. So it allowed us to then balance the sort of workforce. So very interesting insights. But the most important thing I think for us was having the ability with that information to have now this data to make data-driven decisions going forward. It was all very much an assumption. We thought it was busy this time, but now we have the data to do that. And it kind of, this is some of the feedback we've had from the sort of team that's come through. As you can see there, agent satisfaction. It was amazing to see the agents sort of really loving the new system, the way it was working. The role before was very taxing, as I mentioned, with staff. It's been really transformative. And the reason it's been really transformative to the leadership, there was a lady called Sarah Warren and Gavin who were doing some amazing work, and the change management journey and transformation journey they went on was done with all the staff. They all learned together, we all pivoted together, and the success of it was because we got buy-in from everybody together on the actual opportunity. But you can see there by the stats, the engagement, the overall satisfaction has gone up increasingly. So we're not getting people looking to leave. We're also seeing the call volumes that are coming through, although they're significant, we're able to manage and plan effectively. But a really, really good news story, I think, from our organisation. But again, it goes back to those MELD principles I said at the very beginning about a different mindset, being able to experiment, having that kind of leadership support, and then, as I mentioned, having the data that provides you a new way of going forward, and then creating those new skills for the teams. So all the teams have been upskilled in it. So I think, for us, it's been a really, really good success story. And then finally, just to sort of finish off, we've got some time for some questions, was just to give you some takeaways. So I want to say, from an organisational development perspective, the key thing for me here is the ability for your organisations to pair the new technology with talent strategy is going to be absolutely vital. They need to be sort of fused together. So that's the first one. Second one is, don't forget, again, that piece I mentioned at the very beginning about your executives getting a minimum of 20 hours. I know they're very busy people, but even a mandate of 1 hour a month over the next year, you could get those 20 hours in. And the reason for that is this technology is changing. A lot of the research I did, a study on AI, was before generative AI. Generative AI is just kicking off, and we're going to start moving now towards agentic AI, which is where AI will do something and make a decision and do an action on your behalf. So it's really important that our leaders really understand what that is. So they need to get those investment of those hours in. From yourself, from a leadership development, I think have the courage to reimagine your service line. What's the art of the possible? Think about that MELD framework. From a management perspective, I think, again, the missing middle, design roles that fuse both the human and the machine capabilities together so they support one another. Look at that humanizing data strategy in the 5C framework as a really good guide to sort of start off with. And then finally, for personal development, I would say, is taking the ownership about your own career, your own development. I think, don't wait for people to do stuff for you. There's so much great content out there, and hopefully those links will share them. But get yourself on that ultra learning journey. But finally, just to finish off, the most important thing is to ensure that you have responsible AI. Always continually assess the new risks that are coming up, because it's changing at such a rapid rate. But we have to work and work through this together. But that's kind of it. And then finally, just to finish off, there's some great books which I've read, and I'd definitely recommend people to have a look at them. The AI Ladder is about modernizing your AI architecture. It's a very simple, quick read. The AI Competing in the Age of AI talks about new business models and new operating models, because you're able to scale things quickly. You have this thing called network effects, so really, really great book there. And the Economics of AI with prediction machines is really, really good. It talks about how you can use those for your business. And then the last two there, Co-Intelligence, is a really accessible read. It talks about how we're going to be using AI as a co-worker, a teacher, and a coach, but the coach that you need, not that's given to you necessarily. And the last one talks about the economics of AI. So that's it for me. I'll finish there and hand over to questions. Thank you.
That's fantastic. Thank you so much, John. I know it was a bit of a whistle-stop tour, but absolutely fantastic insights from you. I don't think I've got enough bandwidth for my camera at the moment, unfortunately, but you don't need to see me. We have a couple of questions in the chat that I have captured, and Sarah's going to have a look at the ones that are in the Q&A. I mean, so much to take in, and I think people will have lots of questions afterwards. We have said that we will share the slides and the links to everything you have mentioned. They'll get that after the session, and a copy of the recording. Hannah Barnett asked, do you have a link to a maturity self-assessment? I suspect lots of organisations will be wanting to know that.
We've got one that we're working on from I suppose an AI perspective on the CDAO stuff. We're currently speaking to Gartner at the moment. They have a model that we're trying to look at the moment and trying to adjust it so it's fit for the NHS as such. Yeah.
Okay, good.
And we have got one for BI and AI, so BI business and data analytics. We have got one for that. Yeah.
And how can people access that? Where can they go to find that?
It's a service I think the team offers. I think it's something that our team works with organisations. We go in and basically just do a bit of a sort of an assessment, drains up. So that's something we can sort of share links with that afterwards. Yeah.
Yeah, absolutely. That's great. We've got a couple of questions, hands up. So we'll come to those in a minute. I'll just ask the other question I caught from the chat. If we've missed the questions, Helen's going to go through them all and capture them, and John's agreed to answer any that we have. How do we implement the 20 hours of training with execs? Are there recommended course or curricular or criteria?
Yeah, and that's a really good question. There are various sort of, for example, I mean, agencies, recruitment agencies, and organisations that actually come in and actually do deep dives with your exec for workshops for 2 hours and 3 hours. There's also a great amount of content on both, as I mentioned, the Data and Analytics Academy that NHS England have put together. You've also got great training and education that's on the Turing Institute. So there's lots of great content out there. I think it's trying to kind of assess from an exec level what they need to look at, and then put probably a bit of a roadmap. Even just 1 hour a month over the next 10 months would get them where they need to be. So each of, for example, the Alan Turing Institute, you've got the Data Academy, they've got information in there about executive education on there. So it's about picking those out for them and putting a list together. But I haven't seen, it's a good question, I haven't seen a list of, if you were to say what the top 20 areas that you go to, it's something we probably need to pull up as a gap there.
Absolutely. I think there's also the NHS Leadership and Management Competency Framework will be referencing it, and we're sort of waiting for that to be published, and hopefully that will have some context around curricula or particularly competencies that are required, and suggestions for where that training can be accessed.
Yeah, and just to say, Joe, the shout out for AFA. So AFA are doing now accreditation and endorsement now for courses specifically designed for CDAOs. So that's literally due to kick off very, very shortly. So we'll be signposting. So hopefully that gap will be addressed. Yeah.
Yes, absolutely. So we can put a link to the AFA site in the chat so that people can link into that and get the newsletters. Perhaps that will keep them updated on what's coming up.
Great.
Okay, fantastic. We've got a couple of hands up. I'm going to come to Agnes first. Do you want to? Can you unmute your? Yes, you can. Great. Do you want to ask your question, John?
Hello, John. It was really interesting presentation. I'm interested in the example you provided about agentic AI handling telephone calls, as I understood. Could you tell me how did you implement data protection regulations in here? Because this is handling special category data, as I presume these patients had to provide some data beforehand to the agentic AI, which demands option to opt in first. ICO find a lot of organizations forcing using agentic AI on the customers without option to opt in. So how this was resolved in your situation?
Yeah, so just to be clear, so we didn't use agentic AI at all. All we've used is basically an automated call center, which is in the cloud, to answer calls. So Agnes, there's no agentic or AI used on that. It's basically just call handling. So it was the flow of calls, triaging them through to different parts of the team. At the moment, everything used to come through to one person, which had to be triaged out. This was about kind of just streaming calls coming through and giving patients the opportunity to say, look, our service is busy, would you like a convenient time to come back? And they say, yes, I'd like it at 3 o'clock tomorrow, could you call me back? And that's kind of where it was. There was no AI on that. We're aware of within the system you could look at themes, so we haven't done that. That was all turned off. It was just to do a call handling of kind of capacity and demand, matching both those together. So no, agentic wasn't used, and we're nowhere near that yet at the moment, because that's a whole big different area. But
okay.
Yeah. Good question.
So you didn't collect any special category data really in this chat while triaging the call. Okay, thank you very
just
much.
Triaging capacity and demand and matching it, so
Yes.
we could respond to the
I think this is the issue for the most of the call centers, how to go about, opt-in option and, give option to go around the queue, around agentic AI to the real person straight away if someone is not happy with disclosing the data. Thank you very much for clarification.
What I have heard from organisations, I won't mention who it is, but when they do that, when it's coming through, what you do is you put a warning or a message on your system that says your data will be used in this way and be processed. Do you want to, yes or no? And they either opt in or opt out.
Yes.
So that was one way I've heard that someone doing that. So we have not done that though, but that's what I've heard. Yeah.
Fantastic. Thank you very much.
That's great. Thank you, Agnes. Thank you, John. Sadek, do you want to ask your question? And then we'll go to Sarah with the questions in the Q&A.
Sure, thank you. John, thank you for that great presentation and also so much to take away. So thank you for that. So my question is around, which I'm sure a lot of people have, is around information governance. So one of the main challenges we have to even get off the ground to start using AI is IG. I was wondering whether there is an existing IG framework around AI or documentation, that could help shared with the trust that can expedite and kind of help us in this journey, because surely there are a lot of things among us that that we could use this for.
Yeah, so we've kicked off that we have a great IG team within SCW who are experts, and they advise us on DPIAs for data analytics projects as they currently stand. So we follow that kind of process. We have now brought 4 organisations together, and we had a great workshop yesterday on responsible AI and oversight. And what we ended up doing is we've taken, I think I flagged it up, was the Alan Turing guide that talks about kind of 3 or 4 areas on there about and I'd recommend recommend of reading that. But there's trying to think which 4 areas it's got on there. But yeah, that book I would definitely recommend reading. But that's what we've ended up doing, is taking those that guide and applying that internally. And what we've ended up doing, we've split it into kind of 3 buckets. So if we're looking at doing AI internally using Copilot or using some automation, we have a screening process with 6 or 7 steps that need to go through from alpha, beta, and go live. So that's the first bit. So we're trying to get as many people through it, because we don't want to stop creativity, but we want to put the right guardrails in place and they get some education about what they can and can't do. The second block, I remember, I think that was around doing or developing AI models or some AI development with a partner. It could be a university, for example. And then the third one is we buy AI off the shelf. So each of those buckets have got kind of similar different processes. So one of it's kind of a new system that's quite big. We need a lot more assurance and governance that would go to the board. And on the other side, where people are doing it themselves, we want to have it fast tracked. So we are working through those 3 processes. And I think the team would be happy to share once they've got that, what we're trying to do. And we're trying to automate those forms so people can go and fill the form in. But we're trying to get as much information at the beginning, what sort of data you're using. Is it going to be patient identifiable? So all those kind of DPA concerns still stand, as they would do anywhere else. But we're working through that process. But yeah, that's something for us to come back and sort of share with you. But I would definitely recommend, having a look at that Alan Turing guide that's out there.
Great, thank you. Thank you so much for that, John.
That's right.
That's great, thank you. We don't have too much time left, and I have just mentioned that if we don't get through all the questions today, you have very kindly offered to provide some answers, which we'll share with everybody. Sarah, over to you. Do you want to pick a couple of the key questions?
Yeah, if I give you 2 at once, John, then you can panic and forget the second one, because that's what I always do. So I thought a really good one to just have a little practical advice, if you don't mind, around how you would deliver an AI sandpit environment, because I think that's really important. So any advice on that? And then just the more general one, I know we've covered it already in the questions, around any tips for overcoming concerns around IG and GDPR, other than risk assessments. I know you sort of touched on it, but I think all the comments as well are very centered around lots of various concerns around that. So those 2, please.
Just take the second one first on the IG concerns. I think with our IG team, we've got an amazing IG team. I think get your IG teams, if you got them involved as soon as possible. They can always come to SCW. We have a great team that can offer some really good advice. But I think the earlier you get those involved with any processes, the first, the best. Don't leave it to the end. Get them involved with a project straight off. That's the first thing. That's what we always do. And again, with the IG team, as I mentioned about responsible AI, we had the workshop yesterday. We're working together to try and say, well, what does this new landscape and world look? What does responsible AI look like? And what does IG? So we are working together and feeling our way through. But I think get your teams involved, and you can always reach out to SCW. We've got a great team that can try and offer and guide. I think what we've picked up is that I think the NHS is waiting for the guidance to be issued. That's still to come through. European has got some really good guidance around AI, and I think that people are sort of defaulting to that, but they're also defaulting for the NHS to the Alan Turing Institute and the guidelines that come and the regulations around that, and the training and learning there is a really good way forward. But I think get your IG team in first. The first question, going back to your sandbox. You've got the likes of Microsoft, you've got Fabric, you've got AWS with their S3 buckets, you've got Google. All of those technologies offer you the opportunities to set up sandboxes, but I would encourage people to use synthetic data, artificial fake data, housing data, whatever it is, just to test some models and get yourself sort of tested up there, but use synthetic data. And there are ways to set up sandboxes where, and I've probably had time for me to come back, but we set up a paper that allows people to have a sandbox area for, say, 2 weeks or a month. They've got a minimum allowance of, say, £200 or £300 worth of credits for compute or data processing. And provided they go through and they get the business case agreed, we'll spin that environment up. It shuts down in the evening. It starts back up in the morning. So the controls have to be quite strict about what you can and what you can't do and what data you can put in there. But the benefit of that is they can then use those tools. An example of that would be something called RAG, which is augmented generation retrieval for generative AI, where you put all your HR documents, for example, in an area and you get it to query and come up those chatbot responses. So you can do that. But I think, I would encourage people to sort of use synthetic or data that isn't sort of NHS PID data, for example. That's the first thing. But you can set those areas up. That's probably a bigger conversation to come back and show you how we're aiming to do that.
That's great. Thank you, John. And I'm mindful, I'm so sorry we've run out of time, but a whole set of really great questions. And I suspect many others like myself would hope that you could come back and share some more in-depth insights into this fascinating but also vital topic. Thank you for your time today. It's been absolutely fascinating, and some awesome links for people to follow up on. Sarah, did you want to just have any last comments, but also mention about the survey?
Yeah, just I'm conscious everyone probably wants to go for lunch, but thanks, John, as well for everything. As I said, there'll be a survey going out after this that will inform that white paper on organisational preparedness. I think, as we can see today, there is a lot of areas that are not very well known, not well adopted, need a lot of work, and to point to some of the things in the chat, need to be brought together in a central place so everyone can get all the information together. People are doing great things like John, and we don't want that to be siloed. So if anyone could feedback on that paper, hopefully that can help start to bring all that learning together as well. So thank you very much for everyone for being here today.
Thank you for the invite.
Absolutely. Thank you, John. Thank you, everybody. Please complete the feedback survey. Always great to have feedback to reflect on the sessions, and hopefully we'll see you again soon at the next event. Please come along to the next ones, free for everybody to access. And thank you again, John and Sarah, for another great session.